Good afternoon. I'm Bill Newman, Lincoln County, Tennessee Mayor, and this is our Wednesday afternoon press conference. I would like to start with some basics of why we're in this situation. The COVID-19 virus is a new virus, so unless you've been exposed to it, you have no immunity. And apparently that's what's happened in the Wuhan area of China, where the exposure's been for a few months. They're developing immunity and the cases are going way down low. And so we're learning day by day what will happen on this. There is no vaccine yet, and that will develop at some time. But it also emphasizes here in America, we need to be aware of what vaccines do for us for the good. A lot of times we kind of get where we don't pay that much attention of how good our health system is here. But our immune system, which is a wonderful creation God gave us when He created us, is still our defense for a lot of things. And this is the case in this particular situation with this virus. Our immune system starts with our skin. So, you know, a intact skin system keeps a lot of microbes out of our body. And so when they do get on our skin, we want to make sure that we don't give them the opportunity to get inside us through carrying them to our mouth, our nose, or our eyes. We can't prevent totally breathing in microbes, but we can, as the term now, social distance, stay a reasonable distance away from a person. Practice good hygiene, whether it's hand washing or coughing into your sleeve or covering your mouth when you sneeze or cough. But we will get through this, and our immune systems will carry us if we'll do the things that are smart. And one of the things I want to emphasize, just keep our own immune systems healthy, is let's eat right, drink right, stay hydrated, stay active, stay positive. Our body's health is dependent on our mental attitude in a lot of cases. And remember who is in charge. Still, God is in charge. And we need to realize that and continue our spiritual life and practice our prayers and the things that will keep us spiritually active. One of the things, you know, I've mentioned before, and we keep emphasizing, social distance. Whether we're going out to eat, there's lots of things we can still do, but just be aware of a proper distance from a person and proper hygiene. One of the things here in the courthouse and the other offices is a lot of times a phone call will do just as well as a visit. There's some things you cannot do. But when there is a choice, please make the phone call your first choice. And you always can call our office, and I'm going to be giving you some numbers, later, that you can call our number in the office and we will get you directed to wherever you needed to go or get your answer. And that number, our office, is 433-3045, 931-433-3045. Today, our first speaker will be Courtney Sanders. Courtney is with the Lincoln County Health System. She's the Director of Infectious Prevention and Control, and she'll bring us up to date on the health side of what we're going through at this time. Courtney?
Thank you, Mayor. Of course, like we said yesterday, the goal of the health system is to keep our patients safe and keep our community safe and certainly keep our employees healthy. With that, we are putting into place some increased visitor restrictions. So we'll talk first about that. Starting tomorrow morning, Wednesday, March 18th, we will have restrictions in all entities of the health system. Most of you probably are aware by now that Lincoln Donaldson Care Center has all visitation restricted. The only exception to that is end-of-life care for hospice. We do ask that if you need to bring items to your loved one that's there, that you do that during normal business hours and call us first so that we can be prepared to meet you and get those items. We realize that this is a concern, and it's very difficult on our employees, it's very difficult on our families. So we're doing everything we can to keep their spirits up, keep them going, and have interaction with them. Today specifically, they're doing some St. Patrick's Day activities and getting some goodie bags related to St. Patrick's Day. So keeping that going. At the hospital, visiting hours will be limited, 8 a.m. until 8 p.m. daily. 1 visitor per patient, per adult patient. The only time there will be exceptions to that is if it's a minor, then we will have both parents if needed. In our labor and delivery unit, we will allow 2 designated support people per adult patient. There will be no siblings allowed on the unit at this time. We'll also have restrictions at the Patrick Rehab and Wellness Center. That'll be limited to 1 adult patient per therapy, 1 adult visitor per therapy patient. No visitors will be allowed in the treatment rooms and the treatment areas unless it's a minor child or someone who is a direct therapy team member. We'll also, in addition to limiting visitation, we'll be doing visitor screenings. So our access points will be limited. That again is to protect our patient and employees. So we ask that all patients and visitors enter through the front entrance. Employees will be able to enter at a different location, but all will be screened for fever, cough, shortness of breath before being allowed into those patient care areas. We are, in addition to checking for fever, cough, and shortness of breath, we're also checking for contact with a possible or known patient with coronavirus 19, as well as looking at recent travel history for those visitors. Visitors who have a positive screen may be asked not to visit and to either wait in their car for their loved one or go home at that point. Same for wellness members at the Patrick. Wellness members will have to be screened when they go in for whatever session, whatever workout they're doing. We are closing classes at the Patrick, so there'll be no group exercise classes. We also will not have birthday parties, lock-ins, those kind of group activities allowed at the Patrick at this time. In addition to these things, we've been asked several questions about testing within the facility. We do have capacity to test. It is limited. I know there's lots of information that those results would come back within 24 hours and there's unlimited tests available. That's not the case for our area at this time. So we can test, but testing is limited. The most important thing to know with that, and Mayor Newman touched on this a little bit, is that if you develop symptoms, if you feel sick, if you think you may have COVID-19, then we're going to ask you to go ahead and stay at home. Use the Tennessee Department of Health hotline number, and that's 877-857-2945. Again, that's 877-857-2945. Follow their advice on what to do there. You can also call your primary care office and talk to them. So there are options. Not everybody who thinks they have it will be tested during this course, especially while testing's not widely available. Remember, most people that have coronavirus 19 will not need to be hospitalized, but those who do could be severe. So we want to reserve our resources for those community members who do develop severe symptoms related to this. At this time, we have no confirmed cases of COVID-19 in our community that I've been informed of. I know there's a lot of conversation in the community about this, but to my knowledge, we have no confirmed cases. Again, we're closely monitoring the situation. We're in contact with the CDC, in contact with the Tennessee Department of Health, and we'll be adapting our policies as needed according to those recommendations. Policies could change without any advance notice, so visitation could change quickly as time goes on.
Thank you, Courtney. Phyllis Counts, our county clerk, her office is probably the busiest this month, and so I would like for Phyllis to give us some insight on ways that they can carry on the business of their office and maybe not have to come in. Phyllis?
We are very busy, and as the month goes on and draws to a close, we will become even more busy. There are several ways that you can renew your tag. Contact my office. You can renew any license plate if you have access to the internet. You should go online to TennesseeCountyClerk.com. You'll be prompted there for the county that you live in. This will go for any county. You'll be prompted for the county, and you'll enter your information there. It'd be advisable to have your license plate number, your vehicle registration with you maybe to enter that information. You can also mail your renewal request. You can send that into the Lincoln County Clerk's office, and our mailing address is 112 Main Avenue South, room 102. That's Fayetteville, Tennessee, 37334. You can also contact our office through our email address. It is phyllis.counts@tn.gov. Our office phone number is 931-433-2454, and our fax number is 433-9304. There are several transactions that can be handled by mail that we can handle via email and fax correspondence. So please give us a call before you make a trip in, because there are several things that other people can do for you if you're not physically able to come in, or if you don't want to feel compromised to making that trip in the office. But our custodial staff is very diligent daily, several times a day, to come through with our doorknobs, our countertops, and they're doing the best they can to keep us clean and less compromised.
Thank you, Phyllis. And any of these offices, whether it's our health facilities, our office here in the courthouse, or any other office, please be patient and courteous with those people. They have the same stress you have. It's just they have the added job that they're trying to do. Our next one is, I'm glad to have Dan Holt with us here, and a lot of people will know Dan. He is one of our food service people in the area with restaurants and the Holt's IGA at Park City, and he has some real insight far as food and that during this time that we're going through right now. So Dan Holt, if you'll address as far as food.
Well, thank you, Mayor. As of right now, most of the stores in Lincoln County, their shelves are fairly empty. Of course, they're in the process of trying to restock daily. We were supposed to have a large truck come in today with about triple the normal order that we usually get. We were informed after making the large order that not only would we not be getting it today, we would get it tomorrow, but it would be significantly less than what we ordered. They told us going forward that to be expecting about 20% more at best than we normally order. So what does that say to us? Well, we have a store that is significantly lower on inventory today than it should be, and we're only going to be able to restock in very small increments. And we expect that if things continue as they are, that we'll be even more empty by the end of the week, even after having a couple of extra trucks come in. We did get extra orders or extra shipment last week of toilet paper, which was gone within a matter of a few hours. So in the grocery business, we've experienced something nationwide that we haven't ever experienced. We never had a snow threat like this. We've never had any event that caused the people to rush into the stores the way they have the last 4 or 5 days. So here's what we're kind of faced with, is we have a restocking issue. At this time, we don't foresee being able to be at capacity for a long time. We started off with a full store, and now we're greatly depleted, and we're only going to be able to restock about 20% more than what we normally get during an average week. However, we need it to be 150% more to be back like we were last week. So we've got a challenge ahead of us. So what does that say for our community? We're still going to be dependent upon the restaurants for some of our people to eat. because I'll assure you, the odds are good not everyone in this room has 2 weeks worth of groceries there. I know a lot of people didn't go out and buy a lot of extra groceries, so there may not be the food there at the store that they're wanting to get. And we do know that half of the people, or more than half of the people, already eat out regularly. More than half of the food consumed in the United States is bought through a restaurant instead of a grocery store. Now, that was great news when I was only in the restaurant business, but when I got into the grocery store business, I realized that we had a battle against the restaurants. Well, now we're going to have to pull together to make sure everybody gets fed. So the one good thing about that is the restaurants are still open here in town. All of ours are. All the rest of the fast food restaurants, they're all working as far as I know. The one thing I will have to say to all the consumers out there, you are much safer eating in a restaurant today than you were a month ago. Even though the local health department does a really good job of making sure we're handling food properly and we're using proper procedures in everything we do, from cooking to, or from getting it into the restaurant to cooking it to, preparing it to go. We have stepped that up considerably, making sure that everything is sanitized properly, and that not only for our customers but also for our employees. We want to make sure they're safe too. But the food supply issue is not going to be solved only through the grocery stores. We're still going to have restaurants to feed our people.
Thank you, Dan. And staying on that same line, we did check in our office, and these are the downtown restaurants that we checked with, that nothing has changed. You can go to any of these restaurants I'm about to name, get it to go or eat in there. And basically, if you're eating in there, just, do the social distancing and normal hygiene that you would use. But Cahoots, operation as normal. Honey's, operation as normal. The local cafe, operation as normal. Market Street Grill, operation as normal. Raphael's, operation as normal. Then Dan's, why don't you address your restaurants, far as Pizza Inn and Marvin's and Shoney's?
At this time, we are operation as normal. We are doing everything we can to make sure that our customers are safe when they come in. We're sanitizing all the utensils. We're changing them out for people who are going to eat off the buffet. We have the option of giving them some hand sanitizer if they want to after they've gotten their meal. In some cases, we're actually serving it for them so they don't have to touch any of the utensils. We'll be glad to do that. In some of our locations, of course, we're still offering carry out and food to go. So at this time, we're continuing to operate as we were, but with a whole lot more emphasis on making sure we keep everything sanitized.
Okay. And all the restaurants that I mentioned, they do carry out. So you can call, pick it up, and just to reemphasize what Dan said is, we're going to have to use the restaurants as a food source to make it through this. We're not going to be able to just go to the grocery stores. That doesn't solve our paper products situation, but that will catch up on its own there. A couple of things about some of our grocery stores. The Dollar General stores, the one behind McDonald's, they have senior hours now, which will be at that store will be from 7 to 8 a.m. Seniors only, and I think they're identifying seniors only as over 60. So that 1 hour there, seniors can come in only for shopping. At the Dollar General on the Winchester Highway, there before the Lynchburg turnoff, those hours are 8 to 9 senior hours. So one back of McDonald's, 7 to 8, Winchester Highway 8 to 9. The Dollar General, when we called them this morning, they were in pretty good shape as far as their stock. Like all the others, it's down, but they were better than the one on the Winchester Highway. Gerald's, plenty of fresh vegetables, potatoes. This morning, they did have bread. They're changing hours. They're closing at 6, and a third shift's coming in for cleaning and stocking. At Save-A-Lot, their new hours are 9 to 6, 9 o'clock in the morning to 6. This morning when we called there, they did have eggs, which is something hadn't been found at all. But now when we're talking about this afternoon, that could have changed quite a bit. And then when we talked with Holt's IGA, we've mentioned stock was down, but at that time they had plenty of meat this morning at Park City IGA. I have requested that churches not meet in their large gatherings. It might be a good time for small group worship and small group prayer. Don Gray with the Rock Church has reached out to us. If there are specific needs, they will be there to try to help. And I'm going to give you the number there at that church in just a second. So, and the Good Sam office, which is in the Ralph Hastings building, it's been manned by mainly senior citizens, and they thought it best this time if they would close that office. But if we need to open it up for people to get in there and get food, we'll see that that takes place. Don Gray's number, the Rock Church, here's that number, 256-533-9292. Again, area code 256-533-9292. A couple others, let's go back. If you will, Courtney, give them the hotline number again. Let's give that one out. This is, if you have questions about it, think you may have it, you're not feeling well, call your primary physician or call this hotline.
That Tennessee Department of Health hotline number is 1-877-857-2945. That's 877-857-2945.
And Phyllis counts with the county clerk's office. If you will give phone
Can I
number.
just show you this? Can I just do this?
And y'all shoot in on that.
You can say it too for the radio.
Okay, I can.
I'm sorry.
A phone number on that, far as calling in the office, is 433-2454. 433-2454. And you always can call our office, which is 433-3045. That's all I have this afternoon. We will have some information come out tomorrow. I do not know if we will have a 1 o'clock press release, but anytime there's an update, you will be hearing from our office, health system, or any other pertinent information that we need to get out for our citizens. Thank you.